Hi, I'm Dr. Greg Relo with Express Dentist. I'm here to talk to you a little bit today about periodontists. So maybe you've heard of periodontists, maybe not, but general dentists can treat a wide variety of conditions, obviously, but there are times where we need specialists. And a periodontist is a specialist that we use for more complex gum problems primarily, but for some other things too that we'll explore. So, what is periodontal disease? Because that's where the word periodontist comes from. Periodontal disease is basically a disease of the gums, the supporting tissues of the teeth. And there's bone underneath that gum as well. And sometimes there are certain bacteria that will build up and produce toxins and acids, and then there's an immune response in your body, and all that inflammation causes that support system to start to deteriorate. So it can be a very, very serious problem, and it's actually the most common way that people end up losing all of their teeth. And so, symptoms of this would be bleeding primarily, but any like swollen red gums, pain when there's chewing, receding gums, sensitive teeth, and of course loose teeth is a very common one. So if you have any of those signs, it could be an indication that there's periodontal disease, and there may be a periodontist in your future if you want to save your teeth. So a periodontist is, as we mentioned, they're really trained in preventing, diagnosing, and treating gum disease. That's their primary role. And periodontist goes to extra schooling. So a dentist goes through dental school, gets their doctorate, but then a periodontist will often go to school for 3 more years and get additional training. So it's a very, very specific specialty. And in most cases, people end up at a periodontist because they've been referred there by their general dentist. So a periodontist can do a number of different things. We mentioned treating gum disease. That can involve a very deep kind of scaling, it's called, scaling and root planing, where they go underneath the gums and clean off the bacterial tartar deposits. And sometimes that's done with a surgical version where the gums are actually open, so there's access to get in to that area and do a proper job. They may also do procedures that are geared towards regenerating gum tissue. It's difficult to regenerate growth, but some of the new technology does allow that to take place, especially with bone grafting now. There are some instances where there may be some regeneration, which is typically fairly difficult in the mouth. Periodontists are also very good at doing dental implants, and as specialists, they understand all of the specifics that go into that. A lot of general dentists do too, but periodontists have another level of training. So maybe for more challenging cases, a periodontist would be a very good choice for that. They can also do procedures where they reshape the gums, known as gingivectomy, and there's different reasons for this. Sometimes it's just cosmetic, make things look a little less gummy, so to speak. And maybe it helps with cleansability depending on the situation. And then another big area that periodontists are involved with, especially with referrals from general dentists, are grafting. So where tissue has receded, you get that long in the tooth look sometimes, the roots are exposed. There can be grafting procedure where tissue is taken maybe from another area of the mouth, like the roof of the mouth, and placed over the receded area, and the body accepts it as a graft. That's one form. And so that can be a very, very beneficial procedure. Most people who see a periodontist are going to be referred from the general dentist after maybe initial evaluation, maybe initial treatment, depending on the severity. But if you're referred to a periodontist from a general dentist, it's highly recommended that you go, or you face the risk of tooth loss in a very real way. But, you can end up at a periodontist if you choose to. If you feel that just initially you're very concerned about your gums, you have some of the symptoms we talked about, then you may want to just go straight to the periodontist for evaluation. But generally, it's a good idea to see a general dentist first and get an initial diagnosis. Obviously gum disease, we mentioned, can be pretty serious. It's the most common reason that people lose their teeth. And so that's a really good reason to go get that taken care of. It's a bacterial infection and it just doesn't belong in our body. But what's more of a motivation, maybe even in this day and age, is understanding that gum disease is linked to general health. And there's some fascinating research that's interesting to dive into, but basically it's linked to cardiovascular disease, to strokes, to diabetes, to arthritis, even some forms of cancer. There have been found links where the oral bacteria are found in in those sites. And so we don't know the exact cause and link there, but we do know that there's a very strong correlation. And, gum disease, yes, you don't want to lose your teeth because of gum disease, but you certainly don't want to lose your life because of gum disease. And that's a very real possibility based on what the science is telling us. Sometimes people want to know, is periodontal treatment covered by medical insurance? Not usually. It's usually considered a dental service, and so it's going to fall under a dental benefit. And a really good question is, how do I avoid ending up at the periodontist? Really, it's about trying to control that gum disease. And certainly there's some genetic predispositions for some people, but a lot of it is very preventable and at least controllable, if not curable. And so just doing the things that you need to do, the brushing the twice a day, flossing regularly or using a water flosser, avoiding tobacco, either smoking or chewing tobacco, getting your regular checkups, because this disease does not progress rapidly in most cases. It's usually a slow progression. So there's a great opportunity to have it taken care of. So if you need a periodontist, if you've been told you should go to a periodontist, or you just feel like based on the symptoms that's the place that you need to go, Express Dentist makes it really easy to find a periodontist that's trustworthy in your area. And we have a very good list of partners. And if you give us a call on our hotline, we can help connect you anywhere in the country to a periodontist. And we can also help you, of course, with finding a general dentist if you'd like to get to them first to get an evaluation, get a general cleaning, and just see where things stand. So hope that helps. Take care of your gums. They'll take care of you. Take care. Have a good day.